Hello everybody, welcome back to Starkey Farmstead. So get ready to have your minds blown. This is part 2 of the Filipino mafia gang in nursing. And folks, what I'm fixing to talk about is shocking. One, there's allegations that have been made against nursing homes, lawsuits filed of Filipino nurses leaving people in their own excrement, bed sores that led to death. But I'm also going to talk about a pyramid scheme that almost every single Filipino nurse inside the United States happens to be part of. And the most concerning part is that nurse that you think is a nurse may very well not be. In other words, one registered nurse in the Philippines produces 19 using the same license without the education. So the math simply doesn't math. As I dug into this story, I realized that somehow this little country that's considered a third world, in other words, it's not industrialized, is producing 1 out of every 20 registered nurse inside the United States. That is not including those call centers that Medicaid and Medicare use for seniors. So as I dug into it, I realized that there simply are not enough people and enough universities, nursing schools, to get this many registered nurses qualified inside of the Philippines. So what is happening? Filipino registered nurses are coming in through the state of Texas. Why? Why, Sam? Because the state of Texas does not require them to have a social security number. In other words, they can come in with their registered nurse license, come into through the state of Texas into the United States, and then disappear into the system. Now, that one nurse with a license will pass out her credentials to sometimes up to 30 or 40 different people who will use her identity, her nursing credentials to work from call centers for Medicaid and Medicare, or even in the nursing home that your loved one is in. I was contacted today from a whistleblower who has documentation and proof of cybersecurity issues where the Philippines are concerned. The information that was given to me is shocking, but it is also provable, because the people you think are innocent, right? They're the victims. These Filipino nurses are being harassed. They can't speak their own language inside of the hospitals, and they're filing suits of discrimination in the United States, right? Shame on America. They're also being harassed and picked on, the poor little Filipinos. Wait till I tell you what they're really doing. Anytime a Filipino nurse is caught with fake credentials that say they're actually nurses when they are not, using somebody else's identification, do you know what they do? They file a lawsuit claiming that they were human trafficked from the Philippines into America. So these people who are neglecting your loved ones, who are putting your loved ones' HIPAA information out on the dark web, these people who are willing to use somebody else's identification just to get into the United States so that they can create a pyramid scheme, bringing other people in underneath them, just like Tupperware, folks. Those people, when they're caught, rather than going to prison for what they've done, they file lawsuits against the medical companies that hired them and win millions of dollars. They're not held accountable for the physical abuse against America's elderly people. They're not held accountable for the deaths of the people that are harmed because they are not real nurses. This is what I was sent by the whistleblower. Thank you for creating your recent video highlighting the troubling issues around Filipino nurses in U.S. healthcare. I wanted to reach out because your message deeply resonated with me. I've witnessed and researched firsthand over the past 13 plus years here in the Philippines. While the recent raid on a Philippine call center involved in a multi-billion-dollar Medicare fraud scheme was shocking to many, that incident is the tip of an iceberg. The reality is that labor trafficking and healthcare fraud are far more widespread and systematic than most in the U.S. realize. Here's the big picture. Most Filipino nurses who come to the U.S. don't personally work on all the jobs they sign up for. Instead, they operate within a large pyramid scheme, sharing their credentials with multiple workers based remotely here in the Philippines. This practice steals millions of American nursing jobs and creates huge risk to both patient safety and data security. So for all of you nurses that have been going to HR saying, hey, I'm being harassed. Hey, they're threatening me. Hey, they won't speak English. They don't know what they're doing. Patients are being harmed. And you either get fired or they ignore you. The reason that is happening is because human resource officers are getting kickbacks from the Filipino nurses. See, they have to keep you out because you would quickly realize a highly trained, registered or licensed practitioner or a CNA in America, you would know that these nurses have no idea what they were doing. You would see the fraud happening. You would see the medication not being given. You would see the patients not being cared for, and they cannot have that. They cannot have whistleblowers blowing the scheme because they're becoming millionaires by doing this. These remote workers almost always use a personal device and public Wi-Fi networks with little to no oversight, violating HIPAA and other critical regulations meant to protect patient data. Wage disparities and visa loopholes contribute to ongoing workplace fraud, with many immigrant nurses not reporting to their assigned workplaces, but reporting elsewhere under borrowed identities or overstaying their work visas. There is a strong culture of harassment and gatekeeping within some Filipino groups working in healthcare. This is designed to silence dissent, protect these illicit practices, and keep outsiders, all American nurses, from exposing what is actually happening. Because subcontracted nurses cannot physically access patients here, vital signs and other data are often fabricated in the files, putting patients at risk. Visa programs like H-1C and H-1B, combined with a lax enforcement, have inadvertently enabled these systematic problems. Finally, all of this contributes to national cybersecurity crisis, with millions of healthcare records vulnerable to breaches and enforcement and unsafe outsourcing practices. The problem extends far beyond call centers, as most workers now operate remotely from home or other locations, making enforcement and accountability much harder. Now, when I spoke to the whistleblower on the phone, the biggest issue that he told me he sees happens to be with our military documentation. Before, the VA did not share military medical records outside of the VA. In the last couple of years, under Joe Biden, that changed. So our military records are now in the hands of these pyramid schemes, and in places like the Philippines, where there is no protection and that medical information is being stolen and manipulated. Two of the biggest offenders are Putnam and Cedar Ridge for hiring these unlicensed fake Filipino nurses. Now, if this is happening within the Filipino nursing group, is it happening with the Latinos? Is it happening with the sub-Saharans? Is it happening with all these others? Let me ask you this. Why would we in America need to import immigrants for jobs that have always been in the hands of registered nurses trained in America? Folks, this is serious. One day you or your loved one may be in a nursing home. Some of the ugly comments that I got under the first video on the Filipino mafia nursing gang just showed me the truth. One of them said, "Will you nasty Americans leave your old people in nursing homes?" As if that gives them the right to abuse them. Well, you see, us nasty Americans have to work and pay taxes because all of you keep coming over here stealing from the taxpayer pot. So this is fraudulent at a whole nother level. I hope our government starts just ending all visas. We do not need them. We do not. There's not a shortage in nurses in America. And if there was, can I tell you something? Supply and demand. If there was a shortage, then you would see more registered nurses getting better pay and better insurance for their family, better retirement. You see what I'm saying? It would make a competitive field. But flooding it with third world country immigrants doesn't do anything but leave people dying in the bed with bed sores. Make it make sense, America. Like, comment, subscribe. There will be a part 3. So hope all of you hang around. If you'd like to support our channel, we were demonetized for going after these protected classes that YouTube talks about. Look in the top of comments. Love you guys.